Hi all, today we are going to deal with the topic congestive cardiac failure. What do you mean by congestive cardiac failure? It is a severe circulatory concussion due to decreased myocardial contractility. It is a severe circulatory concussion due to decreased cardiac contractility. Due to decreased myocardial contractility, it results inability of the heart to pump necessary needed blood to the body according to body's needs. That is meant by congestive cardiac failure. Next, we have to move on to the etiology of the congestive cardiac failure. Etiology of the congestive cardiac failure consists of congenital cardiac disease, which is most common cause of congestive cardiac failure. All the congenital heart diseases we learned are the etiology of the congestive heart failure. Okay, next is acute heart disease, congenital and acute heart disease. Congenital heart disease, we discuss all the congenital heart disease is the most common cause of congenital heart failure. Next is the acute heart disease. Acute heart disease, what are the acute heart disease that leads to congestive cardiac failure? Rheumatic fever, rheumatic heart disease, myocarditis, cardiomyopathy, paroxysmal supraventricular tachycardia. These are the acute heart disease which lead to congestive cardiac failure. Congestive cardiac failure, congestive cardiac failure, that is acute diseases which are rheumatic fever, rheumatic heart disease, myocarditis, cardiomyopathy and paroxysmal supraventricular tachycardia. These are the acute heart disease which leads to congestive cardiac failure or congestive heart failure. Next, we have to move on to the what are the non-cardiovascular causes or etiology which leads to congestive heart failure. The non-vascular diseases. The non-vascular diseases that cause the congestive cardiac failure are chronic pulmonary diseases. The chronic pulmonary diseases which is due to respiratory infections. We have to study this in a connected fashion. First, we have severe respiratory infections. Severe respiratory infections will lead to chronic pulmonary disease. Chronic pulmonary disease will cause to anemia, chronic cough, due to chronic cough and chronic respiratory infections. We are not eating much diet, so we have to lead to chronic anemia, that is respiratory infections, chronic pulmonary diseases and anemia. Next, nephrotic syndrome. Nephrotic syndrome is a kidney disease. Nephrotic syndrome, and due to nephrotic syndrome there is a fluid overload. Okay, nephrotic syndrome, there is a fluid overload. Fluid overload is due to massive placental transfusion and excessive IV fluid. Massive placental transfusion and excessive IV fluids. Next, adverse effect of anesthesia or surgery. Adverse effect of anesthesia or surgery will result in the nephrotic syndrome, will further result in the congestive cardiac failure. Next, we have to move on to the pathophysiology of the congestive cardiac failure. Pathophysiology of the congestive cardiac failure can be discussed under two headings, that are right-sided failure and left-sided congestive heart failure. Right-sided congestive cardiac failure and left-sided congestive cardiac failure. Right-sided congestive cardiac failure is the pathophysiology of right-sided congestive cardiac failure is when the failure of the right ventricle will lead to when there is a failure of right ventricle which leads to decreased blood volume to the pulmonary arteries. Decreased blood will be pumped to the pulmonary arteries will cause failure of the right ventricle. Failure of right ventricle will lead to decreased volume of blood is pumped to the pulmonary arteries, which causes increased pressure in the right atrium and right ventricle, and also increased venous pressure. This increased venous pressure will lead to systemic venous hypertension. Increased venous pressure will lead to increased systemic venous hypertension, or increased venous pressure will lead to systemic venous hypertension. This systemic venous hypertension will result in tachycardia, cardiomegaly and hepatosplenomegaly. When there is a failure in the right ventricle, will leads to decreased blood volume to the pulmonary arteries and increased pressure in the pulmonary artery, right atrium, right ventricle, and increased venous pressure. This increased venous pressure will lead to systemic venous hypertension, and which will result in a tachycardia, cardiomegaly and hepatosplenomegaly. Next, we have to discuss regarding what are the pathophysiology of left-sided heart failure. The left-sided heart failure have And this failure of the left ventricle will lead to decreased cardiac output. Decreased cardiac output. In right-sided heart failure, there is a decreased pulmonary blood flow. In left-sided heart failure, there is decreased cardiac output, which leads to increased pressure in the left atrium and pulmonary vein. The decreased cardiac output will lead to increased pressure in the left atrium and the pulmonary vein. The increased left atrial pressure and pulmonary venous pressure will cause concussion in the lungs. Due to concussion of the lungs, there is an increase in the pulmonary pressure and causing pulmonary edema. Due to concussion of the lungs, due to lung concussion, there is a increased pulmonary pressure and pulmonary edema will cause. Due to pulmonary edema, it results in tachycardia, tachypnea, pulmonary rales and cardiomegaly. Tachycardia, tachypnea, pulmonary rales and cardiomegaly. We have to note one thing, that there is a respiratory manifestation is seen in left ventricular failure. Due to decreased cardiac output, there is a increased pressure in left atrium and pulmonary veins. Due to increased pressure in the left atrium and pulmonary vein, there is a pulmonary concussion will cause, and pulmonary pressure will increase and pulmonary edema will result. It will results in the manifestation of tachycardia, tachypnea, pulmonary rales and cardiomegaly. In congestive cardiac failure, the myocardial function is diminished. The myocardial function is diminished in congestive cardiac failure, and the body attempts to compensate the diminished myocardial function by increase in rate that results in tachycardia and increased stroke volume. The increased heart rate and increased stroke volume will result in cardiomegaly, and there is a release of catecholamine will happen. This release of catecholamine will increase the systemic vascular resistance and increase, which results in decreased renal blood flow. The release of this catecholamine will increase the systemic vascular resistance. The increased systemic vascular resistance will lead to decreased blood flow to the kidneys. The decreased blood flow to the kidneys will lead to decreased GFR and increased tubular reabsorption. The increased tubular reabsorption leads to decreased or diminished urinary output and sodium retention. The sodium retention and diminished urinary output will lead to edema and pulmonary edema, lower limb edema, etc. The further myocardial stretching results in ineffective contraction of the heart. Heart is ineffectively contracted, and which leads to diminished cardiac output. The decreased cardiac output will lead to diminished cardiac output, and pulmonary and systemic circular congestion will occur. The further myocardial stretching, when the blood flow, systemic vascular resistance will be increased, will lead to decreased renal blood flow and decreased GFR and increased tubular reabsorption and diminished urinary output and sodium retention. When further myocardial stretching will occur, there is it results in ineffective contractions. Ineffective cardiac contractions will result in diminished cardiac output and pulmonary and systemic circulatory congestion. This is all about pathophysiology of the congestive. Next, we have to deal with regarding the clinical manifestation. We have to learn clinical manifestation under 3 headings: signs and symptoms due to decreased cardiac output, the signs and symptoms due to pulmonary concussion, and signs and symptoms due to systemic concussion. First, we have to deal with the signs and symptoms due to decreased cardiac output. What are the signs and symptoms due to decreased cardiac output? That are tachycardia. We are discussed that due to decreased cardiac output and decreased myocardial contractility, heart rate will be increased, that is tachycardia, and poor peripheral perfusion will be there. Due to poor peripheral perfusion, there is weak peripheral pulse and cool extremities. Poor peripheral perfusion will lead to weak peripheral pulse and cool extremities. Pallor will be present and activity tolerance will be present. And tachycardia will be present. Even the tachycardia will be present. Poor peripheral circulation or poor peripheral perfusion will lead to weak peripheral pulse. Weak peripheral pulse will lead to cool extremities, pallor and activity intolerance, and easy fatigability. Due to activity intolerance, easy fatigability will be there, excessive perspiration will be there, restlessness. Easy fatigability, excessive perspiration, restlessness. The signs and symptoms are due to decreased cardiac output are tachycardia, diminished or decreased peripheral circulation will lead to cool extremities, Cool extremities, weak peripheral pulse, pallor, activity intolerance, easy fatiguity, excessive perspiration, and restlessness. Next, we have to learn the signs and symptoms of due to pulmonary concussion. Signs and symptoms of pulmonary concussion: there is tachypnea will be present. Pulmonary concussion, tachypnea will be present. Cyanosis, chest retractions, nasal flaring, grunting respiration. What do you mean by grunting respiration? It is a sound. Grunting sound will be there. During the respiration, there is a grunting sound will be there. That is grunting respiration. Tachypnea, cyanosis, chest retractions, nasal flaring, grunting respiration, non-productive persistent cough. There is a non-productive persistent cough. Persistent cough will be there. There is which is non-productive, which is absent of sputum. Next is pulmonary edema. We have already discussed there is a decreased GFR and decreased renal blood flow. So there is a pulmonary edema will be causing. And orthopnea, dyspnea on exertion, difficulty in sucking and feeding, failure to thrive. Orthopnea will be there. What do you mean by orthopnea? Orthopnea will be the dyspnea that occurs during the changing the position of a patient. That is orthopnea, dyspnea on exertion. What do you mean by dyspnea on exertion? Dyspnea on exertion is a dyspnea happens, difficulty in breathing happens when we are doing an activity. Difficulty in sucking and feeding and failure to thrive. These are the signs and symptoms due to pulmonary concussion. The signs and symptoms due to systemic venous concussion are hepatomegaly, peripheral edema, facial and periorbital edema. These edema are due to, we already discussed, decreased renal blood flow and GFR. Hepatomegaly will be there. There is an enlargement. All are enlargement. Hepatomegaly. The liver will be enlarged. Peripheral edema. Peripheral extremities will be enlarged. Facial and periorbital edema. Next, oliguria, weight gain. Weight gain due to increased fluid collection or fluid presence in the body. Weight gain, oliguria. Neck veins are distended. Neck veins are distended. That is also an enlargement. Next, ascites and dependent edema, anorexia, feeding difficulties. Feeding difficulties are also present in pulmonary concussion. Anorexia, ascites and dependent edema. These are the clinical manifestations. Next, we have to discuss regarding the diagnosis. Diagnosis first we have to check for the history collection and physical examination for the edema and all. Next is chest X-ray. Chest X-ray shows cardiomegaly and hazy lung fails. Cardiomegaly and enlarged heart. That is cardiomegaly and hazy lung fails. ECG shows ventricular hypertrophy. Echo shows assess the extent of ventricular function as associated congestive heart disease. We are discussing regarding the diagnosis. We have first history collection and physical examination. Physical examination we have noted murmur and all. In chest X-ray we have to check there is a cardiomegaly and there is a hazy lung field can be noted from the chest X-ray. In ECG we have to see that there is a cardiomegaly will be present, and through echo we have to assess two factors, that is assess the extent of the ventricular function and whether there is a presence of other congenital heart disease or not. In blood we have to in blood test we have to identify that there is a dilutional hyponatremia, hypochloremia, and there is a hyperkalemia. The calcium will be potassium will be increased and the chlorine and the sodium will be decreased. Coming to the management, we have to manage to reduce the cardiac workload. To reduce the cardiac workload or work of the heart, we have first we have to reduce the work of hours. Our body work will be reduced, the cardiac work will be reduced. So restrict patient's activity. So we have to administer some sedatives and vasodilators. Sedatives to decrease the body's work or body's activity, and we have to give vasodilators. Which are the vasodilators? Nitroprusside, nifedipine, sodium valproate. Sorbitrate, nifedipine, nitroprusside, sorbitrate, hydrolysine, captopril, and prazosin. We have to administer as vasodilators. Next, we have to treat infection, whether there is an infection or not. In case of infection, we have to treat the infections with antibiotics, and we have to control obesity of the patient because obesity will increase the cardiac workload. And next we have to treat the anemia. If there is any anemia, we have to treat the anemia using 3 to 5 ml of packed red cells per kilogram. Per kilogram of the body weight, we have to transfuse 3 to 5 ml of packed red cells for every 12 hours. And IV furosemide. Furosemide is a laxative. Laxative is not. It's a loop diuretic. So if there is any congestive cardiac failure worsens, we have to administer IV furosemide. Next, we have to increase the myocardial contractility. To increase the myocardial contractility, inotropic drugs we have to give, like digoxin to increase the cardiac output, and we have to administer ACE inhibitors to inhibit the normal functions of the ACE of kidney, that is angiotensin converting enzyme for normal functions of the kidney. We have to inhibit by using ACE inhibitors. Thereby, we have to block the conversion of angiotensin 1 to angiotensin 2. So, it acts as a the angiotensin 1 is act as a vasodilation. Vasodilation occurs. Example of the ACE inhibitors are captopril, enalapril, etc. So we have to increase the myocardial contractility. We have to administer inotropic drugs and ACE inhibitors. Next, to remove the excess accumulated fluid and sodium in our body, we have to administer diuretics. We already said that if there is any worsening of the congestive cardiac failure, we have to administer the loop diuretic furosemide. Along with that, we have to administer chlorothiazide and spironolactone. Spironolactone is a potassium sparing diuretic. So we have to administer it. It's a very good loop diuretic is a spironolactone, because there's a potassium helps in the myocardial contractility, and also it acts as a loop diuretic. Diuretic is help to remove the excess accumulated fluid and sodium in our body, and reduces the blood pressure and peripheral vascular resistance. Fluid restriction is compulsory and strict to the persons with the congestive cardiac failure, and restrict the salt and highly salted food. And we have to restrict the sodium of the person to less than 3 gram per day. To improve the cardiac performance, we have to administer the inotropic drugs such as digitalis and digitalis. Digitalis is an antiarrhythmic drug. We have to administer the digitalis and diuretics. Furosemide can be indirectly activate renin-angiotensin aldosterone system, and which leads to vasoconstriction and sodium and fluid retention. So we have to administer furosemide along with we have to administer digitalis along with the furosemide to improve the cardiac performance. To suppress the RAS, we have to administer furosemide combined with the ACE inhibitors. The ACE1 inhibitors prevents potassium loss, so there is no need for either potassium supplements or potassium sparing diuretics. Next, we have to deal with the nursing care of the child with the congestive cardiac failure. We have to maintain the adequate cardiac output. We have to maintain the effective breathing pattern, maintain tissue perfusion, normal fluid volume, normal activity tolerance, and growth and development of the baby will be prevented by us, and we have to maintain the effective family coping. These all are about the topic. Till now we discussed about what is meant by congestive cardiac failure, what are the incident and etiology of the congestive cardiac failure. Next we deal about the pathophysiology of congestive cardiac failure under two headings, right sided and left sided. The left sided cardiac failure have more pulmonary or respiratory manifestations, and we discussed regarding the clinical manifestations under three headings. Signs and symptoms related to decreased cardiac output, signs and symptoms related to pulmonary concussion and systemic vascular concussion, so systemic venous concussion. Next we discuss regarding the diagnosis, that is history collection, physical examination, chest x-ray, ECG, echo and blood. Next, management under three headings, to reduce the cardiac workload and improve the cardiac myocardial contractility, to remove the accumulated excess fluid volume, and also one more heading is there, that to improve the cardiac performance. Next we discuss about the nursing care of the patient with the congestive cardiac failure.